My dad always tells me about he remembers holding me for the first time and my little hand grasping his finger, and he was just like so smitten. So I imagine it's going to be the same for us. So at 39 weeks, they decided that it was time to have the baby. So they just had us come in at 8 a.m. and they were ready to induce me. And we were planning to just do a traditional vaginal birth. And just once they gave me the medicine to kind of help speed things along, Carter just wasn't reacting well to it. And I had to lay on my right side of my body, and I couldn't move, or else his little heart rate was kind of having some inconsistencies and dropping. So it was pretty nerve-wracking for that 8 hours or so of watching his heart rate and trying to get it stabilized. And after the better part of the day, they decided just to go ahead and do a C-section. So we did that, and little Carter was born at 9:13 p.m. Weighing 6 pounds, 9 ounces, and 19 inches long. No diabetes emergencies, my blood sugars. I kept my pump on during the process and throughout the surgery, and just let them know I'm wearing an insulin pump, I'm keeping an eye on my blood sugars. And they were very open and welcoming to that, and happy to have a patient that was, kind of her own advocate and, wanted to be involved. So it all was, as positive experience as it could be. Well, I would say nothing really prepares you for the first couple weeks. Everyone says, make sure you take lots of naps before you give birth, or sleep when the baby sleeps. But when the baby's sleeping, that's when you're cleaning bottles or showering or eating or testing your blood sugar. So it's quite an adjustment the first couple weeks, but it's pretty incredible. Everyone talks about this love that you have for your child, and you really just don't understand it until you experience it for yourself. So it's been really incredible. So after delivery, I did have a couple people warn me, it is challenging to keep your blood sugars, in as tight of control once you've got someone else to look after, and that's certainly the truth. I wish I could say that my A1C is probably as spot on as it was during the pregnancy, but in all reality, there's some ups and downs. Your body's getting more adjusted. You have to change your post-delivery insulin rates and whatnot. Every time I breastfeed, my blood sugar tends to drop. So I always keep a snack right nearby so that I can eat a granola bar while I'm feeding them. To be honest, the blood sugars, they've been a little up and down, but the same kind of scenario as when I was pregnant. Just always have snacks nearby, because you don't want to have a low blood sugar and be taking care of a baby. So my advice for anyone who's thinking about getting pregnant, or if they want to have a baby, first of all, believe in yourself, have confidence that you can do it. More importantly, too, have a good doctor, have a good relationship with someone. If you're not happy with your doctor and you're not feeling like you can get your diabetes in good control, call around, ask for support. Talk to different organizations within your community or within your area, and find someone that is eager and wants to take care of you during your diabetes, because it'll be really important to have a good support system both at home and with your doctor. And for me, that relationship was instrumental in having a good pregnancy, having a positive pregnancy, and getting really great results with this little guy. Remember that women do this every day, and you can do it too. It's all worth it. It's any doubts and concerns that you have, once you have your little bundle of joy at home with you, all those fears and stuff, and all the ups and downs that you experience leading into your pregnancy and throughout it, it's totally worth it. And I would do it all over again in a heartbeat.